Okay. Hi, everyone. Special thank you to those who made it live. Welcome to our second workshop of the year. And today's workshop will be discussing repetitive strain injuries, also known as RSI. RSI affects the whole body. So what I've done is I decided to split up upper body and lower body. So this month we'll first be looking at the upper body, and the next month, please join us again for lower body. All right. So what is repetitive strain injury? So repetitive strain injury, obviously, it's in the name. It's injuries that come from repetitive use. But if we were to give it a definition, it's actually a gradual build-up of damage to muscles, tendons, and nerves from repetitive motion. And like I said earlier, it affects all many parts of the body, most really our peripherals of our body. So the shoulders, our elbows, forearms, our wrists, hands, fingers, but then in the lower body, hips, knees, ankles, feet, and also toes. Okay, so when you have RSI in any part of the body, the most common symptoms that people get is obviously pain. In addition, if there's inflammation, there will also be some tenderness, swelling, and sometimes when it's really chronic, then you can get stiffness, and then more so nerve symptoms like tingling, numbness, pins and needles, throbbing, and then even weakness of the muscles as well. So when you look at this photo, we can see some carpenters, electricians. We can see that their jobs are quite, how to say, risky. It's dangerous. They're up in the sky, up on ladders. And for the most part, honestly, most of my patients who present with RSI are tradies, people who use tools, and they're constantly hammering on, holding machines, drilling, and so forth. But more and more, we actually are starting to see a change in demographics for people who present with RSI. And instead, in office workers, because being an office worker, we have someone joining. Being in the office, typing is also dangerous. So we often joke, the people who type a lot are called computer athletes who walk on their fingertips. So that's also now what we're starting to see in people with RSI. So before I talk about the most common conditions that people experience and what we can do about it, I want to first dive into the root cause, in my opinion. Myself, what I've seen in practice, but also according to research, a lot of repetitive use obviously come from RSI injuries come from repetitive use. But you can have 10 tradies doing the same thing, hammering on all day, but you will find that not all 10 will have the injury. And it's because it comes face down to people who have upper cross syndrome, also known as poor posture. So there is lower cross syndrome too, but because today we're looking at the upper body RSI, I'll be discussing what is upper cross syndrome. So upper cross syndrome is when there is a forward head carriage away from the center of gravity. The shoulders are rolled forward as well. And so what that causes is the deep neck muscles at the front here and the serratus anterior become weak. And then behind the back, in between the shoulder blades, the lower traps, middle traps, infraspinatus, and the rhomboids are also weak. And now when these muscles are weak, other muscles have to work harder and to replace, to balance up the strength. And so that's when you get tightness in the upper traps, levator scapulae, and suboccipital muscles. We see this all the time, and it's what people often present with. When this is what we're talking about, the pain through here and up into the neck, and then right up at the base of the skull as well. So that's where the suboccipital muscles are. But then in saying that, as the shoulders are rolled forward from the head being also forward, we have tight pec muscles and also the sternocleidomastoid muscle, which we know for short as SCM, which is the muscle that goes from your jaw all the way down into your collarbone. So this muscle here, if you just simply, look down, you can really feel that muscle become tight. And in some people, you can really see it bulging out as well. So like I was saying earlier, upper cross syndrome is often the root cause that leads people and makes people more prone to to developing repetitive strain injuries. So your head on average is about 5.5 kilos, give or take 1 or 2 kilograms. I guess everyone's different based on your size. Now, if you have normal posture and good posture, your head, your ears will be over your shoulders. So therefore, your body, your head is in the center of gravity. But as you know, with phones, iPads, even kids' toys these days, so many devices is causing people to look forward. Now, when you look forward, just simply 5 centimeters, it triples the weight of your head. And then if you're moving 8 centimeters forward, you are looking at nearly 4 times the weight of your head. So for American research is every inch, which is about 2.5 centimeters. So for every 2.5 centimeters your head is coming forward away from the center of gravity, it can really increase the weight of your head by about 4.5 kilos, which is a lot. It's nearly double what your head weighs. So the same applies. As your head moves forward away from the center of gravity, you can see here, we were talking about those muscles earlier. That muscle there is contracted, it's never getting used, it's just weak. These muscles are also weak because they don't get used. And now if this gets forward, these chest muscles get tight, and then these shoulders are also tight as well. All right, so what are we doing today is diving into the top 3 conditions that we see in RSI, looking at the shoulders, the elbow, and also the wrist. So for the shoulder, the most common injury is swimmer's shoulder. Now, swimmer's shoulder is really just an umbrella term for shoulder injuries that happen in swimmers. That's because if you swim freestyle, your head's going through a full range of motion and through the whole arc where your wall of your shoulder has to move. So because swimmer's shoulder is an umbrella term, I thought I'd quickly talk about a bit of anatomy of the shoulder. So in your shoulder, you have your collarbone, and then you have your shoulder blade, as you can see here, and then you have your humerus, which is your arm. Now, and then you see that joint there in the blue, that's mostly your shoulder joint. And your shoulder, it has made up of 4 main muscles and tendons called the rotator cuff. So the rotator cuff consists of the supraspinatus, the infraspinatus, the subscapularis, and the teres minor. Now, in swimmer's shoulder, the top 2 conditions we see are tendonitis, and also bursitis. So in this photo, you can see here, when someone does repetitive motion, contracting the shoulder over and over again, what can happen is it can cause a strain, and the tendon can either be strained and just be inflamed, or it could even be torn. Now, when that happens, it will cause other tendons to work harder, and then you're back in a constant cycle. And then when it's inflamed, that's what leads to the pain, the loss of range of motion, the stiffness, and then also the muscle tightness as well. From that, when we see people who have really chronic shoulder impingement and tendonitis, what often also happens is the second most common RSI injury, and that's bursitis, specifically subacromial bursitis, which is under this joint here. You've got your bursa, and what your bursa is it's a sac of fluid, right? So in between all the bones, when you move, it's not just touching bone and bone. Now, when the shoulder has dysfunction, the bursa gets compressed and then it gets inflamed. So more often than not, you'll find people who have chronic tendonitis in the shoulder will also then develop bursitis. A really good way of we can do tests in the chiropractic office to assess this by testing the strength, testing the motion and movement. But a good way of getting an official diagnosis is by simply getting an ultrasound. The next common condition that we see is tennis elbow. Now, tennis elbow doesn't only happen in tennis players. What it is the condition is actually formally called lateral epicondylitis. So this here is your lateral epicondyle, which just means the joint on the outside of your elbow. So it's the outside, and the tendon which attaches into your extensor muscle of your forearm, this muscle gets inflamed. So the most common way of injuring your tennis is doing anything that requires twisting motion and causes a strain through there as well. Another one is backhand as well, and just bending the elbow backwards and forwards. People who have experienced tennis elbow often experience quite a sharp pain right at the bone and the tip of the corner of their elbow, and they'll find that the muscles through here, their forearm, are extremely tight. Now, if you were to go to the chemist, you'll be able to find heaps of braces, right? But sometimes wearing a brace just isn't quite practical. And so what you can do instead is buy some rigid tape, which is like hard tape that's used to secure bones in place. You could use that to tape your forearm instead of wearing the brace. And that way you can wear your dress shirt or whatever, and still the day will carry on. So tennis elbow actually has a very good prognosis. People often heal once they give their elbow or tendon a break. So you can really mostly ice it and rest it, and it should settle. But ultimately, as we know, if you're doing the repetitive movement again, you're still going to get back to square one. So we'll talk about what we'll do in prevention in a moment. Next is carpal tunnel syndrome. So carpal tunnel syndrome is officially the condition where one of the nerves, called the median nerve, gets entrapped in the wrist through the carpal tunnel, which is the space under the ligament. Now, yes, whilst we do know that median nerve compression from the carpal is certainly a real condition, most of the time though, people come in saying, oh, I've got tingling in my hands and my wrists are a bit sore. But most of the time, carpal tunnel syndrome, what people think is carpal tunnel syndrome, actually comes from the neck. So I'll talk to you in a moment about why that's actually the case. But in median nerve entrapment, it gives people pins and needles and lots of sensation, numbness as well in the palm at the 3.5 fingers. So thumb, index, middle, and then half of that ring finger. Now, because I said most of the time it comes from the neck, I would like to show and teach you all, if you're watching this and you believe you have carpal tunnel syndrome, I'd like to show you a quick test you can do for yourself to confirm. So this is what we call a Phalen test. And what you're going to do is you're going to purposely compress the median nerve through your carpal tunnel. And if it gives you pain and tingling and numbness, then that means you actually do have carpal tunnel syndrome. So what you're going to do is you're going to raise the arm up to your shoulders, bring the back of your hands in together, and you're going to purposely push in as much as you can. And if that gives you lots of sensation, numbness, tingling, that means you've actually got carpal tunnel syndrome. If you want to double check it to see if it's actually real or not, then if you switch your hands around and then push down the other way, and that's when, do you get relief or not? And if it's a double yes, well, then I guess you do have carpal tunnel syndrome. There is also an instance where what we call a double crush syndrome or a triple crush. So crushed means essentially we're talking about the impingement of the nerve, right? So the most common location for the, if it really is entrapment of the median nerve, is the wrist, but then you've also got entrapment through the shoulder and also the elbow as well. All right, so that's me discussing the top 3 conditions that we see, but what I'd like to talk about now is what are 3 things that you can do to correct the cause. Well, the main one is, start off with, is to break bad habits. Now, I say this because with repetitive strain injuries, the job just still has to go on. Sometimes it's just unavoidable, but what you can do is make the most of the situation. So by breaking bad habits, some examples could be, if you're at a desk and you have to type and use a keyboard all day, you have to use a mouse all day, what you can do to maximize the situation is by getting an ergonomic keyboard that has a wrist support, and also getting an ergonomic mouse. And these days, what you can do is get what we call a vertical mouse. So your hand sits like this rather than like this, which compresses your the wrist. But the thing is also, even if you do like buy all the gear, right? We have an amazing ergonomic keyboard, an amazing ergonomic mouse. If your setup is poor and you're not using it correctly, there's also going to be no benefit and no point as well. So for example, what I commonly see in patients is they will have a mouse that allows their wrist to sit right. But if their mouse is sitting way too forward, they're still going to be compromising the whole arm as well. So it's important that if you have a mouse, keep it, just sit back by your side and then relax your shoulders. And this space where your arms move is where you can move. But if you sit with a mouse, even if you've got a good mouse and you're moving your mouse like this all day, you're still going to be prone to injuries. Another example I can use for, say, tradies is wearing belts and shirts that balance up things more, and also using different tools for certain things as opposed to changing just the head, making things more specific. And also, in terms of breaking bad habits, you also want to have regular breaks from the repetitive motion. So instead of doing it constantly all day, just give yourself a moment to stretch some certain muscles out, have a break before you continue. The next is adding specific exercises. So yes, you can stretch in the moment with these repetitive joint injuries. You'll have tightness, but ultimately you need to do some strengthening work to make sure that the prone and susceptible muscles and tendons don't get over aggravated. So for example, let's say you are prone to shoulder impingement. It's important that you have good muscle strength between your shoulder blades to make sure that your shoulder doesn't become slouched and hunched over, and that's what puts you in that same situation where you'll be stuck in. So strengthening as well is important with like the elbow. You can simply do movements where you can hold like a water bottle and lift it up as well. And also for your hand, you can just bring it over an edge and just look at just the wrist in that motion as well. I'd like to give you more specific exercises though. So more global specific, but also global exercises that will help your whole body overall. So the first exercise is War Angels. So it's kind of like Snow Angels, except you're doing this against the wall. So the first step is you're going to stand up against the wall. You're going to bring your arms up and you're going to slide it up and then slide it down. But when you slide your elbows down, you want to slide it down back to 90 degrees and neutral. All the way up, all the way down. Now, if you have poor posture, if you have a forward head carriage, if you have what we call a thoracic kyphosis, which is when your upper back is hunched forward, you actually might find that you will struggle to bring your arms back against the wall in the first place. So if that is happening to you, what you want to do is maybe you can take a small step forward, and then that way you can lean back into the wall more, and you can still do your best, at least just with your forearm, to get that movement going. And then over time, as you correct your upper back and posture, you'll find it easier and easier. The next exercise is called You'll Love This, also known as YWLT. It's really just an acronym though. If you remember, You Will Love This, it's much more enjoyable. So what this is actually a muscle to switch on the muscle behind your shoulder blades that I was talking about earlier. Gets your arms and hands moving as well. So because it's an activation muscle, all you need to do is put your arms in that position and hold it. So you're not contracting as hard as you possibly can, but it's just a little bit contraction so that the muscle is switched on. So Y is up like this, W, squeeze back. So the thing is, when you do W, you don't shrug your shoulders and do it. You want to relax down and just gently squeeze back. Love, bring your arms out. It's one L, one reverse L, squeeze back, and then this is just straight out. So with You Will Love This, what I recommend to my patients is doing each letter for 15 seconds simply because if you add it up, 15 times 4 equals 60 seconds, so it's only a 1-minute exercise. This exercise is particularly very good for office workers who sit a lot, are in that hunched position with a forward head carriage as well. Yes, then you want to also be stretching the tight muscles. So in terms of stretching, there are so many stretches out there simply just because there's so many muscles as well. But a really good one for your shoulders would be stretching through your pecs. So just up against a wall or a door frame, place your hands there and just turn away, and you'll get a really nice stretch through there. For your forearms, I don't know if you can see this, but you want to be up against, imagine there's a table right in front of me, and then you want to place just the fingertips on the table, and then, so pretend my fingertips on the table, and you want to lean in and lunge. Then you're going to do the same by turning your hands around, and you're going to place just the palm on the table, and then once again, lean in. So that's really good for the forearms, but then you can also dive in deeper by going like this and like that. I just find it's easier if you lean your whole body up against the table because you get more of a global stretch, as opposed to this is just often closer to your wrist. If you do have carpal tunnel syndrome, and that there is median nerve entrapment, there is some exercises called nerve flossing. I can't get into it today because it's a little bit much more complicated. But if that is happening, don't hesitate to ask myself or Marcus in the practice, and we can show you more specifically how to do the nerve flossing. Thirdly, last but not least, it is to get adjusted. Well, there's a big reason for this, not only because it's obvious that when you get adjusted, your joints, the joints in your shoulder, your elbows, your wrists will be properly aligned and functioning better, more mobile, which will help with inflammation. But actually, because I spoke about, if you remember from the very beginning, a lot of this comes from the poor posture and upper cross syndrome. And what happens is when people have upper cross syndrome, they act, because the neck is coming forward, there's going to be more likely compression through the neck, which impinges what we call, if you can see here, the brachial plexus. So what the brachial plexus is a bunch of nerves that originate from the lower part of your neck. So C5, 6, 7, and then C8 nerve roots, but also the first vertebrae of the upper spine as well, the T1. Now, the nerve root comes from there, but it actually branches out as a bunch, and then it distributes and splits up into smaller nerves that make up the rest of your body that runs down your arm, including, we spoke about earlier, the median nerve. So yes, you can support the median nerve locally where things are, and that will help, but it's important that you get to the root cause. And what the chiropractic adjustment does is it removes nerve interference from the spine to restore the connection between the brain and the body, so the brain can communicate to the body's nerves saying, look, we need to ease up the pressure, and then it helps with the nerve distribution as well. So it's really about getting adjusted, is really about supporting the nerve supply, which affects the nerves of your body, because that's what will ultimately cause your injury in the first place. But secondly, also help with the proper true healing. So C5 and T1 is what affects comes from your neck, but it also travels down through into the shoulder, arm, and your hands and your fingers. All right, so that's a wrap, guys. I wanted to finish off by inviting you, if you have any questions, feel free to ask me now, or otherwise, if you would like to ask in the practice or have your body and spine checked, also, you're always welcome to come in, call the practice, email us, and we'll always be doing our best to help you. Does anyone have any questions? No? Can't see.
Not from me, thanks, Cindy. That was great. Thank you.
That's okay. All right. And yeah, just if you really enjoyed today's workshop and you're interested in more educational content, feel free to like us on Facebook or head over on YouTube. This video will be, it's recorded right now and it will be posted up on YouTube for you to rewatch if you wish. There's also a history of all our other workshops that are on YouTube as well. All right, so if no one has any questions, I'll wrap it up, and I hope everyone has an amazing night. It's around dinner time. I hope you all rest up. Thank you.